Rescue 3, 11 Proctor Boulevard, cardiac related. See Charlie response, 1328.
When someone's having a heart attack, it means a blood vessel is blocked at that time, and that blood vessel needs to be reopened in a very timely manner. Because again, if that delay goes on, the more time that you have that muscle isn't receiving oxygenated blood, the more damage can occur. What has happened is we've actually designated certain particular hospitals to handle certain heart attacks. Just like we have stroke centers, we have these what are called STEMI-CENTERs now that handle people that have heart attacks. We have the heart monitor in the ambulance. Basically, the ambulance rolls up to the scene. You've called because you have chest pain, shortness of breath, difficulty breathing, sweatiness, some nausea, vomiting. So we think that there's a heart attack actually occurring in the patient. So the ambulance rolls up, the paramedics come in, they bring in a heart monitor, which basically takes a picture of the patient's heart. This is captured on the heart monitor, and it used to be this picture was taken to the hospital along with the patient. Now this created some delays. Once the patient got into the hospital, the doctors in the emergency room would take a look at the monitor, they would look at the patient, and they would make a decision as to what was going on. And then the time that it took between the time that decision was made until some definitive care, some therapy was instituted was quite some time. What has developed over the years is when those paramedics come in, they realize that this is a heart problem, they take a picture of your heart with the heart monitor. Then that picture is actually transmitted wirelessly. There's no wires. It's transmitted wirelessly to the laptop computer. From this, via technology that I don't quite understand, this is transmitted to the hospital so that the doctors in the hospital, at a very short time after the picture is taken of your heart, the doctors in the hospital can see that picture. They can concur, they can agree with the paramedics that yes, this is a heart attack happening and what we need to do about it. And the therapy is instituted a lot sooner.
Paramedics respond to a call if they determine that an EKG is necessary. They'll take the EKG, and once it's been captured, they send it to the laptop via Bluetooth. The software is designed to go from ambulance computer to hospital CAREpoint. Now, St. E's has a hospital CAREpoint. It's designed to import from the cardiac monitor, and once it's been imported, to go directly to the hospital CAREpoint. And once it's been imported, it only takes a matter of seconds for the EKG to get to its destination. And we're set up right now to go either to St. E's or St. Luke's, and whoever else should get it. ER, cath lab, medical director on his BlackBerry, cardiologist on their BlackBerry, and we can build this into however many people have to receive it, get it, and put it in the hands of the people who make the decisions and who have to make those decisions as quickly as possible. The sooner they get it, the more rapid the communication, the better the outcome for the patient.
It's a big advantage in that it's almost like real time. What we're going to be able to do is, instead of doing double the data entry and stuff like that, we'll be able to finish a PCR, which is a patient care report, on the computer and be able to send that right over to either one of the ERs, whether it be St. Elizabeth's or St. Luke's. And we'll also be able to attach to that the data that we receive out of the cardiac monitor, to where the receiving hospital will have the cardiac output as far as on the monitor be sent right to the hospital, and they'll have it long before we even get there.
Well, this allows the emergency room to actually prepare for what they actually have coming versus assuming what they might have coming. So they have more of a definitive idea on how they're going to treat the patient when the patient arrives.
The idea started with then Assistant Chief Fran Manfredo in cooperation with Assembly Person Rowan DeStito, and their collaboration resulted in an award from the Office of Fire Prevention and Control for the purchase of computers for the apparatus and the ambulances. That was the beginning of this technology. Without the computers, without the laptops, what you see in the ambulances would not have been possible. So that was the beginning. Our Director of EMS Operations, Lieutenant Mark Ambrose, pushed me to look for a better way, and one phone call led to another, and I fell into a conversation with someone, the Vice President of General Devices, Kurt Bashford, and as it turned out, his company was working on a cutting-edge option for transmitting 12 lead en route to an emergency room. And we partnered with them in January and acted as their beta test site for this new technology.
There was a learning curve as far as, a lot of new technology, something that's been embedded in EMTs for, guys that have been here for over 20 years. Now all of a sudden, August 1st, 2005, we started an ambulance. Now all of a sudden, coming up on August 1st, 2010, we're going to electronic PCRs. It's a change, but once they see it and become accustomed to it, it's definitely a lot easier. You tell them that you don't have to do 2 reports, that you're only doing 1, and once it's done, it's done. That's when they appreciate the usefulness of it, ease of it, and that it's a lot better than where we were at.
Well, for me, I was very receptive. I've always been technology driven. I've always been, right back from my college days, I took computer programming courses, always been involved in computers and cutting edge technology. So when I heard about it, I had no problem adapting to it. I'm actually drawn to that, so that helped me a lot. Some of the other guys might drag behind a little bit, but they have to learn it, and they do. But for me, I thought it was a great thing. I was ready to jump on it, and I did.
It's helping in some way. The paramedics are the ones in the field. They're the ones with the the courage to go out there, be on the front line, not knowing what call is going to change their lives forever. Paramedic is a dangerous job. There's no question about it. They're the real front line soldiers in all of this. So whatever I can do, however small it is, to make it easier for them, make a difference for the patient. That's what it's all about. Not only saving lives, but saving their quality of life. We know that's what we're doing with this superior product.